everybody, Michelle Lyons with you here. Thanks so much for visiting my female pelvic pain rehab course. I'd like to just give you a tour and a glimpse of some of the things that we're going to be talking about in this course. We're covering a lot of different diagnoses and labels in this course. We're going to talk about painful periods, endometriosis, we're going to talk about bladder pain syndrome, interstitial cystitis. We're going to talk about lots of different issues that involve different structures within the pelvis as well. But all the while, we're going to be keeping our eyes focused front and center on the whole woman, on looking at what's going on at a musculoskeletal level, because sometimes the issue is in the tissues, but we also want to take into account what's going on a psychosocial level. So we will be looking at how neuroscience and education and empowerment really is essential if we're going to help women live their best lives. Some of the topics that we'll be covering will be, we'll be looking at what's going on from a neuroanatomy in the pelvis perspective. So we'll do an overview of the neuroanatomy of the pelvis, because not every neuralgia is pudendal neuralgia. There are other nerves that we need to be aware of, so we'll be discussing that. We will be talking about bladder pain syndrome, or painful bladder syndrome, or interstitial cystitis. So we'll be talking about some of the confusion that the different names can cause, but also some whole woman-centered treatment options. We will be talking about vulvodynia, vulvar pain, vestibulodynia, again, how the definitions have changed over the years. What do we need to know about providing a treatment strategy that is not only evidence-based, but is also going to be effective? We will be having conversations about the uterus. We will be talking about painful periods. We will be talking about adenomyosis. We'll be talking about polycystic ovarian syndrome, PCOS. We'll also be talking about something that's happening outside the uterus, but the uterus is often blamed for, and that's endometriosis, and some treatment strategies for that. We're going to have a combination of internal and external strategies, primarily external actually, because what I want to do is I want to give you a toolbox to help women help themselves. So I will talk about internal strategies, and I will guide you through myofascial techniques that integrate brain and body, and really showing you how to help women help themselves. That's really my goal. So absolutely, we will be covering the anatomy. We'll be looking at the structures in around the pelvis, front, back, upside down, inside and out. We will be looking at other structures that can affect the pelvis as well, because it's more than just what's happening in the vagina. You have to remember how close the hips are to the pelvic floor, to the vulva, and how hip and lumbar and sacroiliac dysfunction can be drivers of pain in the pelvis. We'll also be looking at how we can integrate education. Yes, education around neuroscience and what we know about talking about pain, and really giving women, again, tools to help themselves. So we'll look at nutrition. We will look at mind-body strategies. We will be talking about meditation and mindfulness. We will be talking about yoga. We will be talking about strength training. We'll be talking about cardiovascular exercise. We'll be talking about assessment as well as treatment. And we'll really be talking about how to help you be confident in really trying to provide a strategy that is going to help women who for many years have probably been brushed off, told this is all in their head. We'll be talking about teaching women about their own anatomy. So, talking about clitoral anatomy, for example. So here's a lovely little life-size clitoris that we'll be talking about. So yes, muscles are important, nerves are important, but at the end of the day, we are working with women, with a story, with a journey. And what I want to do is I want to give you a series of assessment strategies, of downloads, of video instructions that are going to help you understand specific diagnoses, but also treatment pathways, and hopefully enhance your clinical reasoning with all of this. I hope you'll be joining me. Thanks for watching. Bye for now.